Okay, so maybe let's start and we'll have people who join midway. Hello, and welcome to our webinar on sanitation, hygiene, and child development. My name is Ruhil Iyer. I'm a research officer at the Sanitation Learning Hub, based at the Institute of Development Studies in Brighton, in the UK. Thank you all for joining us today. This particular webinar draws on our most recently published Frontiers of Sanitation issue on sanitation, hygiene, and child development. So before we get into it, just some background. In 2013, a seminal Lancet study found that if 10 nutrition-specific interventions were also scaled to 90% coverage, stunting would only be reduced by 20%. So this has led to renewed attention in the around the potential impact of nutrition-sensitive interventions, and such as WASH in particular, on child linear growth and stunting. So what does this mean for WASH practice and programming? How should we be thinking about emerging concepts like transformative WASH and One Health within our programming? So this Frontiers of Sanitation draws on transformative WASH to explore and outline what is required from WASH implementation and stakeholders to support child development outcomes. It explores multiple ways in which inadequate sanitation, hygiene, and also environmental cleanliness can affect physical and cognitive development in children, and explores areas beyond hand hygiene and considers food hygiene and broader environmental cleanliness beyond human feces, and also considers animal feces. We will then discuss how the WASH sector can improve current practice to support best outcomes and improvements for child development, and in particular opportunities for children to both survive and thrive. So before we start our presentation, just to introduce our speakers, Alison Macintyre and Claire Strachan. Alison is a technical advisor in the Health Systems Governance and Financing Unit at the Nossal Institute for Global Health at the University of Melbourne. She's a public health practitioner and researcher with a background in environmental determinants of health, behavior change, and health systems research and practice. Claire is a principal advisor at the Nossal Institute for Global Health, also at the University of Melbourne. Claire is a senior level public health professional with specialization in health systems, One Health, and child health and development from a multidisciplinary perspective across a range of low income and middle income settings. So over to you, Claire and Alison. And maybe just before you start, I'll mention if people could just put their questions in the question and answer section or in the chat, and we can get to them after the presentation, but please feel free to start putting the questions in.
Thank you, Rahil. Well, good morning, good afternoon, good evening, everybody. Good evening, certainly from us in Melbourne. So I'm going to start off the presentation today just to elaborate a little bit more on what we did and why we looked at what we did. And then Alison will move on to talk about what we found through our review and what will be reflected in the report, which is launched today. So just to start with, when we asked you to register for the presentation today, we asked you to put down 3 priorities of things that you would be interested in finding out about from the webinar today. And this is a word cloud which presents those findings. So just to touch on this quickly, we will certainly be looking at all of these things during the course of the presentation. The 2 things we probably won't look at, well, we certainly won't look at, are menstrual hygiene management, but also schools. While child development can obviously include up to the age of 18, and WASH does play an important part in education attainment, school attendance and retention, we very much focused on early childhood development during the scoping process of this project. There will also be other things which we will touch on, but pleased to see from this word cloud that I think will hopefully meet some expectations in terms of scope. Next slide, please. So the poll. So just to build on expectations, we thought it might be useful to start with a question which I ask you to identify most which areas of expertise that you associate with. You can put down more than one. We'll give you a minute just to add those in, because I think that will help us understand the perspectives of where people are coming from, what they're most interested in. And I think always useful with these scoping reviews when it has an entry point such as WASH, but very much draws on a range of disciplines. It's useful for us to get a sense of where people are focused. So we'll give you another minute or two.
We've lots of answers coming in, and I'll publish them in a sec. Maybe 15 more seconds and then we can publish. Okay.
Great. Okay. So as expected, WASH, sanitation and hygiene and behavior change. I mean, there's a good breadth there, and One Health as well. That's really interesting to see. Great. Okay. So some good cross-sectoral expertise. That's really helpful. And Farouk, yes, the presentation, Rahil, will the presentation be shared? Yes, it will be. Great. Thank you. All right. So to move on to the next slide. So we thought we'd start off with this quote because we think this really highlights early on that while it'd be great if the work we have done leads to simple, clear, actionable recommendations, in reality, that's not always the case. And childhood development is as complex as child health and child nutrition, and therefore, the best way to address these interlinkages through WASH is also complex. So that's a bit of a disclaimer at the beginning to say that we won't be producing some very clear, actionable recommendations. But what we hope to do is sort of convey how complex some of these interlinkages are, but also provide some pathway forward in terms of what to do with the emerging evidence in that space. So as Rahil mentioned already, this report is out today. The focus is sanitation, hygiene, environmental cleanliness for child development. You can download it from the website. It'll also be in the chat, hopefully. Frontiers series are designed to be practical in nature. They synthesize current evidence and emerging practice that highlight a range of things which are relevant to WASH practitioners at all levels. So WASH practitioners at global levels, as well as the field level and everything in between. So this webinar really summarizes what emerged from the scoping review that Alison led, which we both worked on, which informed this report. And just to note that while the main focus of the study is on sanitation, hygiene, and environmental cleanliness, we do use the term WASH throughout the webinar and the report, just because the literature didn't make the distinction, and it's a very easily identifiable term. But it's worthy to note that water quality, availability, and quantity were not a key focus of this study. So why look at this? Rahil touched on this earlier, but just to elaborate a little bit more, because it is an important piece of background. In 2013, there was a key study in the Lancet which found that assessed nutrition specific interventions, if they were scaled to 90% coverage, then stunting or chronic undernutrition, which is when children have low height for their age, would only be reduced by 20%. This really sparked a big debate amongst various sectors, but really a deeper recognition of the importance of determinants of child health and development, including WASH, and really spurred a deeper assessment of WASH, nutrition and development interlinkages and research and discussion and dialogue in that space. And then moving forward to 2019, there was results published from 3 major randomized control trials that assessed the impact of combined basic WASH interventions on child linear growth. These showed that in the contexts that the studies were conducted in, there was no real impact of those specific interventions on child linear growth. which then spurred the WASH sector to think differently about how WASH relates to nutrition and child development, which really led to the concept of transformative WASH, which Alison will be speaking more about a bit later. And as you can see from the expanded and reconceptualized F diagrams from USAID and WHO in the bottom left-hand corner, fecal oral transmission understanding has really expanded now to consider the specific needs of infants and young children, the role of animals, and more holistically at WASH systems, which really looks across the whole sanitation chain and relevant non-fecal oral transition for enteric pathogens, such as through feet and skin, such as hookworm. So what did we want to find out? We really wanted to find out, sorry, our lights go off sometimes in the office at the time of night, then they go back on again. What do we want to find out? We wanted to really find out about the ongoing challenges and gaps. What's the current literature and evidence telling us about the links and what is emerging? We wanted to explore some practical examples around WASH, child development, child health and development. So really to look at how the programs were engaging with these issues, what was the evidence of success or otherwise when they were not working, and what are some good case studies across different contexts of holistic interdisciplinary efforts in this space. And then really, what does this mean in terms of practice, recommendations, looking forward, what are the priorities in terms of further research, and what are the recommendations for people working implementing in this sector. So we used a scoping methodology to capture the breadth of evidence rather than assess elements such as strength of evidence or delve into specific areas, which we felt was the most appropriate way of getting across the emerging evidence in this space. So this really is an overview of what the report will cover, really building on what I was just saying. So it's really about the ongoing challenges and gaps. Why is child development important? What are the links with WASH? The changing landscape in the WASH nutrition, child development linkage space, emerging considerations, WASH in young children, food hygiene, WASH in all settings, and the role of animals in WASH-related diseases, which really links to this emerging, growing, evolving space of One Health. What examples are there in the sanitation and hygiene programs that are engaging with environmental cleanliness and child development considerations? So what is required of the WASH sector to improve child development outcomes, really understanding transmission pathways, baby WASH, and collaboration with nutrition, health, early child development and educational sectors. And then really about what practitioners can do, what are the key learnings, recommendations, and gaps which need to be prioritized for further research. So at this point, I will hand over to Alison to really go through in detail what we found and the recommendations which emerged from our work.
Thanks, Claire. So in order to capture that breadth, we had to, I guess, narrow the scope to some extent, but also make sure we were capturing everything that we could possibly look at. So in terms of child development, we really defined that around best supporting children to reach their physical and cognitive potential. And as Claire mentioned at the start, while WASH is in and of its own right, certain elements of WASH, so water, sanitation, hygiene, environmental cleanliness in and of themselves, have individual and compounding effects across child development up to the age of 18. We focus specifically on the first 1,000 days, so from conception up to the age of 2, and to some extent up to the age of 5, so this early childhood development period. And to guide the scoping review, you can see the table we have on the right-hand side of the screen. We adapted a table from WHO's guidelines for sanitation and health to really not only just look at the infections that might be relevant, but also some of the consequences of those infections, and then the ongoing impacts later into adulthood and intergenerational impacts. And you can see there's a huge breadth of what emerged as possible interlinkages and areas to explore in the table on the right. This is not meant to be an extensive table. It's not looking at the strength of evidence within this table, but to really capture the breadth of what came out of the literature. And while we didn't focus on every single one of these, what we took from that is to make sure we captured across the 3 columns areas that were relevant, and then focus down specifically in line really with Sanitation Learning Hub's area of focus on enteric pathogen transmission and predominantly in rural settings. One, for sanitation learning harm, but two, also because that's where lots of the literature is focused. Now, while that table is sort of well structured and quite linear, in reality, it's not like that. And we've represented this diagrammatically in the report to look at, actually, there are feedback mechanisms and way in which each one of those areas interrelate and can impact the other. So for an example, if you're exposed to fecal pathogens and you can contract an infection, that will potentially lead to environmental enteric dysfunction, which in and of itself can make a child more susceptible to infections, and then will feed back and have increased potential increased infections or risk of contracting WASH-related disease. And then if a child has environmental enteric dysfunction, they're potentially more likely to be stunted and can have short stature later in adulthood. This has implications further on, particularly for women who, due to short stature and stunting, are at higher risk of obstructed labour, or if they contract infections during pregnancy, higher risk of preterm birth, which in turn can have an impact of the child in utero, and they can then have greater risk and susceptibility to infections in early childhood. So it's just really to capture that complexity in what we looked at. So what really emerged, and what we focused on here and in the report, is not, I guess, what's more generally known about the links between WASH, child health and child development, but focused on those areas sort of a bit further outside the box. So the first was really a concentration on the WASH needs of young children in those first few years of life. And we'll talk a bit more about sort of the concept of baby wash that emerged out of that. But two key interesting areas we've drawn out for the presentation here. And one is geophagy, which is the sort of mouthing and soil of dirt. And children, either from their hands, if they're touching soil, or on the ground, frequently mouth soil, or through toys and other objects that they're playing with, can put soil in their mouth. And obviously there's risks in environments that are contaminated with faeces in terms of infection and exposure to fecal pathogens. One interesting thing here to note that we did find in the literature, that geophagy is also common among pregnant women, particularly across parts of Africa, but all over the world, up to 80% in some communities. So women are eating soil when they're pregnant, in terms of if they're for hunger, to deal with nausea, but also for micronutrients such as iron. And obviously there are risks out there in terms of impact on the child development and child in utero if women are contracting fecal oral infections through this ingestion of soil and dirt. And the other area is around safely managing child faeces. A lot of WASH work focuses on adult faeces, but it's also thinking how child faeces can be better managed. It can potentially be more infectious than adult faeces. It's often not addressed directly in programming, and there are a lot of socio-cultural beliefs and practices that can, such as that their child faeces aren't unsafe, but also the disposal of the faeces can cause harm to the baby. Another area that emerged quite strongly in the literature is around food hygiene. And when I'm talking about food hygiene here, I'm looking specifically at point of consumption at the household, but obviously WASH can have an impact across the whole food chain, from sort of the production of food, the transport of food, the storage of food, etc., and where it's sold. But we were looking particularly at what emerged most strongly. Sorry, we're going to have a bit of a disco in here. We have to set the sensors off again. Apologies. So where food's consumed at the household level, and things that emerged were considerations around washing hands as food's prepared, making sure that plates, forks, spoons were also cleaned, that water is safe for baby formula and other food substitution products, looking at the storage of food, making sure it's protected from flies, keeping the kitchen clean, free from rodents, making sure food's off the floor, and free of other animals. So there are several areas of food hygiene that are relevant to WASH. The other areas WASH in all settings, sort of traditionally WASH is focused at the household or the community level, for example, what was tested in the randomized control trials, but less so looking at WASH in other settings. And children either carried or move around quite a lot. They don't stay inside households only. And so particular areas to consider are healthcare facilities, predominantly around the time of birth, that if there are safe wash and better infection control at healthcare facilities, it reduces the risk of mothers and children contracting infections at this point. And if infections are contracted, it can have implications on child development, but also in terms of building trust for the healthcare services so that children and their caregivers trust the service, use the service when needed, and also they can be models for hygiene practice for the community. The other area is early childhood development centres, and while there's a lot of work that's gone on in WASH in schools, there's less around early childhood development centres, be them formal or informal. And the studies that we did find showed that often the wash conditions were quite poor. Many children were sharing the same potties. Potties weren't often cleaned or faeces disposed of adequately. There wasn't appropriate infrastructure around hand hygiene for young children. And then also the other considerations that are more baby wash focused. So having clean play spaces, safe food hygiene that's prepared for children, etc. in these places. And then also other settings. So when children are accompanying parents to formal or informal, or caregivers to formal and informal work settings, and also areas where they might play outside the household setting. And the other area to consideration is the role of animals in wash-related diseases. And this, which I'll touch on momentarily, can be more complex, but we focus specifically on animal faeces, what emerged around the risk of exposure of children to animal faeces, but also the role of animals in being mechanical vectors for moving human faeces and animal faeces to areas where children are. So now we'll move to the second poll. And this one is just to understand, for those of you who are on the call, out of those particular areas, which ones that you might currently be working on form part of your research practice that we've covered. Just leave it for a minute or so for people to vote.
We have some responses coming in. I'm just going to give it another few seconds.
Sure.
Maybe another 10 more seconds and then we can stop it. Okay.
Great. That's very interesting to know that in some form there are people on the call that engage across all those areas. But the one that features the most is none, which is also relatively interesting. So hopefully there's some content in here that's new for some on the call, but would also be interested when we get to the discussion to hear from people who are working, specifically in some of these areas, and if and how their work can inform a way forward for all of us on the call. That's great. Okay. All right, so now moving, I guess, to the second part of what we were addressing. So how could the WASH sector adapt, and what did we find in terms of what people were doing out there to address some of these areas? And what emerged are really three concepts that is sort of have emerging and growing definitions. And the first was that around baby wash, which tackles that area of wash and young children, so the wash specific needs of children during their first few years of life. And then the second that we talked about at the start is this concept of transformative wash, which is really stepping beyond basic wash services to look at safe, sustainable wash systems looking more comprehensively at behaviours, reaching high levels of sustainable coverage for all. And that's really a concept where WASH drives major change to reduce risk to pathogens in the environment that might cause harm to humans and to animals. And then within that is this much broader concept of One Health. And I'm just going to share a diagram. There are many out there, and there are probably, particularly those two people who work in One Health on the call, ways in which this can be represented. But One Health is really an approach that looks at these intersections between different sectors. And here the example is around environment, animals and humans. So how animals and humans interact, humans in the environment and animals in the environment. And obviously WASH has a role to play at all those interfaces. And we can have more discussion about this in Claire's an expert in this area. So please do raise any questions if you have them. So I'll talk them through in a bit more detail now. So baby wash, and this term might be fairly familiar. It's sort of been emerging over the last few years to some people on the call, but it really captures specific interventions and behaviours that help support a reduction of exposure to harmful pathogens to babies and infants during the first few years of life. And it covers a breadth of area, and these are some highlighted from the UNICEF guidance document that we reviewed, but it covers things like looking at WASH in healthcare facilities at childbirth, the food hygiene components, preparing baby formula safely, looking at appropriate kitchen, hand hygiene, food hygiene during weaning and feeding children, having safe play spaces for children that reduces their exposure to contaminated soil and faeces, looking at hand hygiene of both children and caregivers, separating children from animals, and also hand hygiene around breastfeeding and looking more broadly at household cleanliness. So a variety of behaviours, technologies and considerations to really protect children in this critical period of life. And one key example that came out of the literature is the development of baby and mother WASH guidelines in Ethiopia. And this really stems from much broader aspirations and goals around WASH and nutrition policies in Ethiopia. And it's a very comprehensive document that brings together actors from agriculture, from education, from health, from WASH. And what is really interesting is it talks about if and how actors from government, from private sector, from NGOs can work together on this issue. It provides clear guidance of what should be done at the national level, subnational level, local level. It has clear indicators about how progress is being measured and the roles and responsibilities of different actors and different sectors in delivering these guidelines. And they were designed in a way that each sector could contribute to improving WASH-related behaviours and issues to support child development and support good child health. Early implementation has been successful, and some of what's really driven that is having coordination processes at all levels, that there are specific focal points within ministries who work on this and are accountable to this, and just a really strong leadership and sensitisation process from the outset, from national down to local levels when these guidelines were developed. There's a review process going on, and some of the areas that will need to be considered in the updated version of the guidelines are really things like, where does financing come from to implement these guidelines, but for broader infrastructure related issues that might emerge, for example, WASH in healthcare facilities, where they play a critical part in the guidelines, but the infrastructure lines to address some of those gaps are not clearly defined. And then also ways in which accountability can be strengthened to continue to maintain motivation and action across all the sectors. The other area that emerged from the literature is just really understanding some of the local context and really from a transmission perspective. So what are the major health issues in an area, looking specifically at where data is available, specific pathogens and the behaviours, practices, social norms that sit around those. So it's not only just about the presence of infrastructure and potentially what pathogens are there, but if and how transmission can be addressed, or I guess where harmful practices or social norms exist that are really driving some of that transmission. And so there are studies that are starting to look at particular pathogen prevalence and best ways in which to break those transmission pathways. But obviously this diagram from the WHO guidelines for sanitation health really highlights at lots of different points, including behaviours, systems, etc., that this might occur. So it's really trying to understand the local context, what harmful pathogens are there, what behaviours are either sort of facilitating transmission or blocking transmission, and how to either foster or change those related behaviours and modify the infrastructure and prioritise processes accordingly. There is guidelines out there on some of the wash in other settings areas, particularly around wash in healthcare facilities. WHO and UNICEF over the last few years have really developed lots of guidance and learning in this area, and there's a website in the report that contains a lot of this. But as you can see on the left, there are tools around continuous improvement to wash in healthcare facilities, but also guidelines out there for specific needs of young children in healthcare facilities. There is work that's been done on early childhood development centres, particularly guidelines that are pictured here on the left. One key important thing is, though, is not just to look specifically at infrastructure, but also those considerations more broadly around sort of baby and young children wash as part of those. There's no available data globally or clear indicators on how to measure wash in these settings, but I would imagine that learning from wash in healthcare facilities and wash in schools is to really think about taking systems approaches and working in a cross-sectoral way. There's less out there about wash in formal and informal workplaces, some around menstrual hygiene management for women, but also an area to explore. And then the third around wash in other play spaces. So when children are playing outside the home, risks around sort of open sewers, stagnant water, etc. Then, of course, the wash sector can't do this alone. I think the quote at the start really highlighted this, that as complex as the issues are, as complex as the outcomes need to be, and the wash sector can't do it all, and collaboration with other sectors is essential. And this is true for One Health, but also the example that we're highlighting here, which is around nutrition, health, early childhood development and education actors. And there's a study that was done by WaterAid and Action Against Hunger, looking at specific examples from 3 countries around what really worked, what's been learnt about cross-sectoral action. And some of the learning that emerged is on the screen on the left, but really leadership at all levels, not just at a national level. Similar to the baby wash or the mother and baby guidelines for Ethiopia, but policies need to be there. They need to support integration, that there needs to be strong financing and governance, costed plans, that the right data is collected, used to track progress, but also target where efforts need to go first or continue to be driven. That really, for some of these aspects, a lot of it's about learning. Contexts are different, understanding what works where, what are the best ways to deliver and sustain services and behaviours. And really critical is accountability. So it outlines who's accountable to what, that there's transparent processes around that it's reviewed, followed up and actioned. And then there were several areas where there weren't, well, there was not a lot of evidence that we found in the review that we did, but potentially important for consideration. And that is urban wash and child development. So considerations in the urban setting in particular, particularly overcrowded informal settlements, that despite the leadership from WASH sector and the incredible work that's been done around gender rights and inclusion in WASH, that it wasn't actually reflected all that well, or was there a lot of particular guidance around considerations around the early childhood period, the first 1,000 days, and if and how work can be done to consider gender rights and inclusion in integrated programming for WASH child health and development. The other area is around this sort of gestational period. So the first 300 days or so of the first 1,000 days, and this is when a child's developing in utero, and the impacts of poor WASH, particularly on pregnant women during this period, or women of childbearing age. And the fourth is, I guess, a newer area for consideration is around the potential impact that antimicrobial resistance can have in the future of how WASH programs run and the potential impact on child development. So now to section 3, what can be done? And there were, I guess, 9 key areas where we developed, I guess, sort of recommendations, ideas, or potential ways forward for WASH practitioners. And first is really around that gender inclusion and rights approaches. So to really take learning and approaches that have been successful in the WASH sector and embed those in joint programming for WASH and child development. That it is actually really critical to ground all responses in the local context. And that, I guess, was really highlighted in the transmission pathways section, but that local disease burdens and impact on child development will be unique or differ across contexts. So will behaviours, so will infrastructure. So there won't be a one-size-fits-all approach to address this adequately. And that local contexts change. This isn't just a one-off at a point in time, but to continually keep revising an understanding of the context. The other one is expand that traditional WASH package from a basic set of interventions, sort of, you know, improved toilet, looking at safe water supply, hand hygiene, to expand that to include other behaviours, considerations around animals, food hygiene, and baby wash. And that really links to 4 and 5. There've been some modelling to show that to really drive the health gains and child development gains, that WASH needs to really be present for everyone, everywhere. So to look at really driving change at a district level, at a province level and a national level, and that to take a systems approach so that things can be managed, for example, across the whole sanitation chain and hopefully sustained into the future. And then to move beyond just considerations of households and communities, but to look at other settings such as healthcare facilities, early childhood centres, workplaces, etc., because children do move around. It is dynamic in those first few years. That actually there's data out there to inform some of this, and there are ways in which WASH programs could use health-related data in country to target programs, to prioritise certain interventions. And this can be available through national surveys, health information systems, or available locally at healthcare facilities in particular districts. So to improve practice around guiding some of that prioritisation and planning around health-specific needs. And this, of course, can't be done alone. So coordination is critical, both at a One Health perspective, but also across other areas such as education, agriculture, early childhood development. And this needs to be incentivised. There needs to be sort of clear incentives. This needs to be supported financially, and the time taken to really work in cross-sectoral ways. And that while hand hygiene is important, obviously what's emerged is there are lots of other behaviours to consider. And so ways in which to design, explore and drive more complex and adaptive behaviour change and embed those strategies in the approaches that the WASH sector takes, and work with other sectors who also have expertise and skills in delivering those. And then finally, there's still a lot to learn, and there's still a lot not known. So there is validity in continuing to do basic research to really understand some of those transmission pathways, impacts of WASH and health, but also how do we do this, capturing what works in which settings, what could be scaled, adapted and used elsewhere. And that brings us to the end and the last 2 polls. So we're going to do 2 polls to finish. The first is really around out of those areas where work can be adapted and changed, what do you think is most urgent to explore further? So which one of those areas that we've discussed across the presentation should be explored further? Just leave it a minute or 2. There's lots to read on the choices.
Can people add more than one?
Yeah.
Yes. But don't pick too many. I mean, you can. You're welcome to do whatever. I agree all, but
Okay, maybe I'll give it another 20 seconds.
Yeah, sure. Some of them are quite long. So.
In case you'd like to read the whole thing and it doesn't appear for you, if you hover with your mouse on each of the options, you'll see the whole option. Okay, I'm gonna end this one.
Well, we have a few. So baby wash, obviously one area that quite a few people feel strongly about taking further. Interestingly, not gender inclusion and rights is not a feature, even though it was the #1 recommendation, which is really interesting to see. Not that the recommendations are ordered, but yeah, that there's actually interest across all areas, really, which is good to know. So the next one is related to this. Poll #4 is related to this. And what do you think is most actionable out of those? Or in a short period of time? Sorry, I've summarized that slightly different. I'll read it out. The question is sort of which are the most feasible recommendations to action in the short term? So what could WASH implementers do now to start working more effectively to address child development outcomes? Also, we'll acknowledge these recommendations aren't not necessarily to say these things aren't already being done, but these are what did emerge from the study in terms of what does need to be done. I understand there's lots of work in several of these areas already underway.
I'll just give it another 10 seconds. So everybody could answer. Okay.
Oh, it's good to know that all of them somewhat can be actioned immediately in the short term. But that areas particularly around expanding that traditional wash package, which I think there's probably lots of examples out there for different elements, be it food hygiene related, baby wash related, potentially expanding into sort of animal feces management to some extent. And also health data to inform wash programming, which I don't think is super common, or at least in the literature that we saw was particularly common in practice, but good to know that's an area of focus. Coordination, which I think, yeah, it's probably going to be fairly essential. Yeah, so great to see a mix and that they all are actionable, because it is very complex. I wouldn't say that any of it is simple. But yeah, and with that, I might finish the formal presentation and pass to you, Ruhil, for questions and discussion.
Thank you very much, Alison and Claire. We have had, so we have one question already, which I'll start with, but in case you would like to ask a question, please either raise your hand or type your question in the Q&A section or put it in the chat. However, whatever you feel comfortable doing, please go ahead. I'll start with the first question that's already come through from Simon. Great presentation so far. Could you explain the One Health concept in a bit more detail? So I'll pass that over to you. Maybe Claire, and then
Yeah,
Alison.
Sure.
If you want to go, Claire. Yeah.
Sure. So One Health is really an evolving idea which has been had even more traction and sort of promotion since beginning of COVID, really. But at its core, it's about the interaction of three sectors: human health, animal health, and the environment. Although there's even more discourse around how that in itself is limiting. It should cover many sectors beyond those three sectors. But that's really its core focus, and you'll see many of the diagrams for One Health do focus on those three sectors. But as well as those overlaps of those three technical areas, it's also about the methods for collaborating more effectively across those areas to improve the health and well-being of communities, animals, and ecosystems. So, for example, looking at governance, decision-making structures, processes, institutional community communication to improve outcomes alongside technical interventions. So if it sounds nebulous, that's because it is quite nebulous, and there's lots of debate around how it can best be done, and even if people can agree on the theory, actually rolling out One Health interventions effectively can be quite challenging. One of the sort of key examples really is which has been talked about most commonly because of COVID recently, is emerging infectious diseases, zoonoses which arise in animals, and how they're compounded by changing agricultural practices, ecosystems, regional movements, and therefore there's pathogens spill over into humans, and therefore successfully preventing and controlling these threats alongside requires disease prevention and management capacity, not only in animal health populations, but also human populations, and surveillance structures need to speak. So surveillance systems need to speak across those two sectors. Governance needs to enable effective collaboration, communication, integration across those sectors. But there's many other examples beyond zoonoses and pathogens spillover from animals to humans. But really it's about looking at processes as well as outcomes in terms of more efficient and more effective outcomes in the short term, medium term, and long term. So I hope that's clear.
That was great, Claire. Just to sort of touch on one thing I didn't really talk about that much in the presentation, which is only a very narrow concept of One Health, but just bringing in even the animal, just conceptualizing some of this from a WASH perspective. But even if we're just looking at animal feces, and obviously there's sort of broader zoonotic disease related to WASH that can be considered from a One Health perspective, but it's looking at it not just in one way. I think what's in the report is really predominantly looking at the impact of animal feces on human health, but obviously there's impact of human feces on animal health, and this can have feedback loops in terms of that exposure then feeds back into humans as well, etc. So it's also looking at in sort of a not sole linear way of looking at the impact on human health, but also how that impacts the health more broadly of the environment, of animal health, and even how they're connected. So there's that aspect as well.
Yep.
Simon also has his hand up, so I'm just going to allow them to speak. Simon, would you like to unmute and ask your question?
Right, thank you very much. Thank you. I think I first of all want to say thank you very much for organizing this, and thank the presenters, Alison and Claire, for this insightful presentation. My question is that I think you alluded to it. If you look at in some cultures, we consider baby feces. Baby feces are not dangerous. What I mean is that it is we don't see it as containing any pathogens. And so in some cultures in Ghana, I'm participating in Ghana. In Ghana, in some cultures, when your baby, or you're feeding your baby, or you're feeding yourself, you're eating whilst your baby is lying on you, and accidentally the baby defecates into your food, you're not supposed to throw away the food. You're supposed to eat, otherwise it signifies that you are rejecting the baby. And so in your studies or in your readings, have you come across the differences between how contaminated baby feces are compared with other children, maybe 1 year and above, and how can we use this data to change behaviors and cultures that believe that baby feces are not dangerous to human health. Thank you.
Thanks, Simon, and firstly for joining and that, really great question. So firstly, the literature that we read didn't look particular at sort of points at which feces could be most contaminated related to age. It sort of didn't go quite into that detail. But obviously some of that is related to exposure of children. I guess they have to be exposed to those pathogens to then obviously expel them in feces. So, there could be sort of hypothetically, but I'm not an expert on the exact literature, but where some of those major exposure periods are, particularly around weaning, etc., where children are often exposed to harmful pathogens within that process. So I can't answer that particularly scientifically from that perspective, but obviously, in process of weaning, children for various reasons, poor food hygiene, etc., can often have high rates of diarrhea and wash-related disease around that. Definitely in the literature that we covered, many sort of cultural beliefs and practices emerge. Not only, I think there's quite a few studies that have shown that there's a belief that child feces are harmless, but also some of the cultural beliefs around how to dispose of feces. So we touch on in the report ones around the idea of throwing child feces into a latrine is seen as similar to just throwing the baby in there as well. That there are issues around even using a shovel to remove child feces from yard or the ground can lead to harm to the child. So it might lead to scratches down their back, etc. So there are lots of complex processes, not only in terms of the belief of how potentially harmful it can be, but also challenges around then how to dispose of it in a safe way, and cultural practices around that. In terms of how that's been adequately addressed, that we didn't cover that in detail, more so just some of the considerations and challenges that are faced from those beliefs and current practices, but less so around if and how they've been effectively managed. But I think part of that leads to that understanding the context in the first place and what some of those beliefs are, rather than sort of some blanket messaging and technological approaches to try and address those gaps, be that through kind of potties or messaging around disposing of them safely without really understanding what some of those cultural beliefs and practices are. So I think in the first instance, it's unpacking them, but there was no silver bullet for if and how they've been addressed, at least in the scoping study that we did.
All right, thank you very much. Can I make a follow-up comment, please?
Yes, please go ahead. And meanwhile, if anybody else would like to go after Simon, if you could just raise your hand or put a question in the chat or the Q&A section, that would be good. But yeah, please go ahead, Simon.
All right, thank you very much. I think it's good to know. Generally, what I want to suggest is that perhaps a better collaboration in research in this area is important, especially in Ghana, that has adopted the community-led total sanitation as an approach for rural sanitation. We need to have a targeted kind of messaging so that because if you go to the communities with CLTS, what we do normally is to target open defecation, and so to ensure that communities avoid open defecation. But some of these baby feces can also contain some pathogens that if you don't have that kind of targeted messaging, we will solve one part of the problem and the other problem will also persist. And so we are open for further discussion to see how we can work across this, especially using Ghana as a case study to explore this further. So thank you very much.
Thanks, Simon. Just to say what I should have commented, that actually, evidence did emerge that, child feces can harbour more pathogens than adult feces. So just to say there is evidence out there. I can't say particularly sort of at what age does that peak, and it might be different in different contexts, but obviously they are exposed more often, particularly with all that sort of hands in the mouth, putting everything in the mouth, particularly if they're contaminated. Yeah.
Right, thank you.
Farouk, would you like to go next? If you wanted to just unmute and ask your question.
My name is Farooq Siddiqui, and presently I'm working as a program director of a project that is Municipal Service Delivery Program. Actually, we are focusing on the provision of safe drinking water to the people of a particular town. Besides this, we are also working on sewerage system. You know, prior to this, I have worked in a World Bank project where our focus was to provide wash facilities in Toto. And we also focused on the schools of both the girls and boys, where there were no toilets. You know, this wash is a very comprehensive term, and it has unfortunately not been given that much importance as it should have been. I just wanted to have this comment that if we are really sincere and dedicatedly, we want to improve the living standards of our people, we should focus on these wash activities and interventions, and then we will have to focus on health and other issues. So primarily, these are the wash activities which needs to be given due attention. That's my comment. Actually, I don't have any question. And as regards this presentation, you know, this was very excellent, and I would love to go through it again after this webinar is over. Thank you to the presenters, and thank you to the organizers.
Thank you, Farooq. We will share slides with all those who have attended today, so you'd have a chance to look through it a bit later. And we normally also put the webinar recording on the Sanitation Learning Hub YouTube channel, and we can also circulate that link. Are there any other questions? There's one in the Q&A section from Kate, that there's strong reluctance to pen either animals or children to keep them separate. Have you found any successful programs that separate animals and children?
Yeah, that's a really good question, and I think warrants further exploration. So really in this scoping review, I suppose the animal component only formed a small part, and even personally for myself would love to delve into it a lot more. But what did emerge from what we found is no particular sort of one solution worked well, but that it is really complex and depends. There are different considerations in different settings, and I'll give you an example. So looking at if we look at the potential impacts for child development, one solution would be, okay, let's separate the animals from the children by putting them in a pen. And you can put the animals in a pen, but if, for example, they're pigs or chickens, they're often foraging animals. So that means normally they'll just wander around and find food and eat. There's no need to have specific food available for them. But if they're penned, then they will need to be fed. So there's cost to a household around having animal feed or collecting feed for the animals. So that can not be an option for financial constraints. There can also be the issue of, even if there is food available, there are issues around, you know, adequate water supply. That these animals need something to drink if they're not drinking from other sources. So having troughs available and having water available for them to drink is another consideration around that process that makes it ineffective in some settings. Even if they are penned and all that's possible, there's a huge amount of fecal waste generated, and actually sort of globally animals produce the most amount of fecal waste in the environment. And so that needs to be managed in a way. And even that might eliminate the feces from the child. It might not necessarily stop the child going to the pen. Or if people are frequently moving from where there's sort of a large amount of animals and they're penned and there's a high amount of feces in and out of the household, actually some of the health benefits of that penning are diminished. So I'm sorry that I can't say, you know, there are really successful methods, but it is really complex and there are lots of considerations to consider, ways in which, I suppose lots of considerations, even if people are spending lots of time removing shoes before entering households, keeping households clean. So even if waste is transported in, it's moved out, starting to look at considerations for animal feces management. But I think it definitely warrants a lot more research and I guess a deeper dive into practices that are out there, in what contexts, what's worked, what's not, if and how this can be done, and even just assessing some of those possible approaches and if and how feasible they are in some settings.
Thank you, Alison. Claire, do you have anything to add?
I don't think so, actually. I think Alison answered that quite well. I'm not aware of any additional research which speaks to that specific point, either in terms of successful examples. So I was just thinking of the similar points that Alison was talking about.
Okay, great. I see we don't have any hands up or questions, so please go ahead, raise your hands. Robert, could you unmute and speak?
Yes, thank you. That was extremely interesting and informative and exciting. And I think we'll still be very grateful to the three of you for this. I wanted to ask you a question about methodology and methods, because in the word cloud which you presented, I was scanning it as fast as I could. And I think the word methods or methodology was not there. But historically, RCTs, particularly the 3 RCTs that you mentioned, really are inappropriate for conditions which you've used this word complex again and again. And it's exactly it. And the causality is complex. So my question really is, have you got advice or a methodology which people can use in the field, at the local level, that will be appropriate for their conditions, to find out what the priorities should be for them, because the priorities may be different in different places?
Yeah, that's a very good question. We touched slightly on the report a bit about, I guess, the challenges of randomized control trials looking at impacts of basic sanitation services on child health and development outcomes, but definitely don't venture further into the solution side of things. So it definitely does warrant exploration. And it's, yeah, I think, as you said, Robert, it's methodologies rather than methodology. And if I think of just one thing in particular that emerged, so as part of this, we scoped the literature, but also did some targeted key informant interviews for people who work across areas such as behaviour change, One Health, sort of WASH and health program implementation. And I guess one consideration that we weren't able to review specific literature, but we did hear from people, I guess, at the sort of the forefront of some of this work, that some tools are being developed and tested around trying to understand some of the transmission pathways in a more rapid and applied approach. There are research studies out there that do that in detail that's probably not replicable in real world settings, but there are efforts from kind of the NTD and WASH interface, or neglected tropical diseases and WASH interface, and just generally in WASH trying to understand some of those processes. But yeah, that's all I can say. I don't know, Claire, you might have some more insight across that as well.
Yeah, I think it's a great question, and yeah, I mean, it absolutely, it speaks to yeah what we were hoping to highlight up front in terms of how some of these interlinkages, or there's nothing linear about this. There's so many factors there, and it's the social determinants of health and various other determinants of child health, development, WASH, which have all linked together and very contextual. So certainly methodologies I agree with, and they would need to have various qualitative components to it. But I think key is ensuring that there's focus on evaluation, exploration across sectors. But to say all of that wouldn't want to imply, well, the interlinkages and the space is complex. We wouldn't want to imply that it has to be incredibly complex methodologies to try and understand some of the processes or what's happening. And what we also hope to highlight through the report is that while this is an emerging space where there's still lots of gaps in understanding, gaps in terms of evidence and case studies, what we hope is that practitioners and people working in various ways in WASH programming or WASH related service delivery, child development related nutrition services, all these spaces, if they can document what they see, what the outcomes of their work are, try and add some operational research component to that, to share learnings from, you know, that in itself, you know, to take an open inquiry approach and try and document some insights. It can be incredibly valuable, even from one community. And, you know, that may be replicated in other communities or may not be, or may be seen in other communities or may not be, but the more evidence which can emerge across different spaces, the more that can evolve the dialogue and methodologies with which we can further explore. But I think generally across infectious disease, understanding, I think there is, and certainly in spaces like malaria as well, there's increasingly a movement back to the community and a sort of more grounded approach to understanding what's happening and how we can rethink some of the progress or not progress in, you know, which we're seeing, and how we can make methodologies more contextualized and community orientated. So we definitely would support that.
Yeah, I find that am I talking? Yes. I find that a very exciting replies because you're suggesting, if I can take it possibly sort of half a step further, that people should innovate in the way in which they find out about things according to their local context, and not just to be contextual in terms of being in touch with the local conditions, whatever they are, and the local priorities are. But to go beyond that and to develop their own particular approaches that fit what they're trying to find out about. And I just want to put a footnote about, please, this is an appeal, please don't encourage any RCTs, because RCTs are not appropriate for complex, variable situations. They're a disaster. And those 3 studies that you mentioned, I wouldn't have expected them to come up with any results, because if you match the methods they were using with the reality they were looking at, it was almost certain to produce noise, which is very largely what it did. But it had a good effect because it stimulated a lot of investigations and research, some of which was represented in this presentation. So thank you.
I agree. I think there's definitely a big movement towards outcome harvesting or you know, other terminology of what you want to call it, in terms of just rethinking how we can measure things and understand things, and that shouldn't be intimidating to people. It should be hopefully inclusive, in that, if you know, it sort of sends a message that everybody, you know, has a perspective and can be involved and can rethink how these things can be understood and measured, and that may just be about, you know, speaking to various people to kind of gather insight and writing it up, which will then continue the dialogue and identification of gaps in progress.
Thank you, Robert, and thank you, Claire. We have a comment in the chat from Eddie about how with COVID, WASH has become even more relevant and poor communities face further challenges in getting relevant WASH materials and trainings, which then eventually also affects children. And just also flagged, there's another question in this Q&A from Diego, saying one of the main problems of main points of concern seems to be the expansion of the WASH program, given the lack of considerations within it, particularly focusing on women and children, participation programs for safe drinking water access, which methods could be applied for a transformative learning. That might include understanding of gender roles within localities and communities. Otherwise, how could plural approaches be considered and given the generalized framework WASH seems to be locked in? Do any of you want to go first? Alison, and then maybe Claire?
Yeah, I'll talk. I'll have to go back and go through that second one again, or just even if Diego would like to ask or talk through that. Oh, sorry, a bit more. On the COVID one, I mean, I agree. There's been, particularly around hand hygiene, I'm not sure I'd go, I'm by no means been sort of scientifically tracking the progress, but obviously WASH has become more relevant, particularly hand hygiene and aspects of solid waste, I think, disposal as well. I'm not particularly sure about the impacts of COVID on water and sanitation. Particularly, there might be others on the call who are more up to date on some of those impacts. So I agree there is a kind of this window from an advocacy opportunity or profile opportunity around COVID to address some of the issues that were raised before around the challenges around sort of advocacy, prioritisation and importance of WASH for child health development. But yeah, at least across sort of other areas, yeah, related to health service provision and others, there are greater inequalities being driven through this process. And obviously there are going to be even sort of scarcer resources, be that from government levels or programs as well, to address some of these issues. So only to say, yes, I guess from the perspective just of this report, we discussed early on not to sort of delve deeply into how COVID-19 specifically in the literature that's emerging around that is having an impact on child development in consideration to WASH or more broadly. And I don't know, Claire, if you've seen any of the emerging literature around that, but it definitely is sort of worth following and understanding that there will be, as well, we're going to use the complex word again, but sort of multifaceted impacts for WASH and child development more broadly.
Yeah, I mean, I mean, what I've seen, I mean, I think COVID has been a game changer in terms of, you know, health communication generally, you know, and certainly in relation to hand hygiene, which has been critical. But, you know, the way we often think about sort of health promotion in this way in terms of materials and trainings, I think COVID's sort of taken it to that next level in terms of digital information, which is obviously, you know, disseminated, digested, accessed in many different ways across the world, but certainly has enabled reach of communities, which, you know, across, you know, including poorer communities, you know, because, you know, obviously internet access is in many parts of the world now. It's not, you know, it's very broad. And it's linked to that. I think it's also very contextual in terms of the way that, you know, it's linked to various priorities, COVID waves, you know, access to water already, you know, I think there's so many different contextual factors. I'm sure there is a lot of research out there, which I equally are not fully across at all. But I think that, yes, you know, communication around these things has changed with COVID. And I think it's still early on to see kind of how things will sort of settle over time, because we're obviously seeing different behavior changes with different waves coming in and out of lockdown across different settings. It's very variable. So yes, I will stop talking around that, but yeah, it's a good question.
I agreed. And to go to the second one from Diego, I just want to hope I've interpreted this right, but it seems to be focused really around some of the gender and inclusion components to the way that programs are designed, and sort of which methods specifically could be applied. Well, that was one of the challenges. I don't know it, and speak up, Diego, if I haven't interpreted that correctly. So particularly for this, please do go if I've interpreted.
Yeah, no, that's actually exactly what I meant. It's based around, I shamefully missed the poll when you asked about the gender inclusivity in general, and I was actually quite concerned of seeing that it was quite missed on that point. So basically, yes, how can programs really look past the point of where it is? Because a lot of the programs that I've been looking into, they maintain the same framework of how the gender role is interpreted by both the people that are studying the locality. That does not include also the cultural aspect of how the gender role was also shaped. And that also creates a big impact whenever you're trying to do a participatory program itself, because you want them to be able to become independent as well through it. But how can they do it without having that understanding, perhaps?
Yeah, I think it's a really valid question. I'll answer. Ruhil, I might pass to you just in terms of maybe some of the other Sanitation Learning Hub Frontiers of Sanitation reports that you have addressing some of these gender-related issues. But just to comment on this specific issue, I agree. I mean, I have to say, I was surprised at, I'm sure that there are studies and practice case studies out there of where some of this has been addressed, but at least in the scoping review that we did, there wasn't really a lot around the gender sort of aspects that might be considered, particularly around this first 1,000-day period where a lot of the responsibility or targeting of work could be placed on women and burden on women as primary caregivers, and not take into consideration some of these social norms or harmful social norms that might be sort of potentially firmed or sort of reaffirmed through some of the programming approaches that are adopted. But I am sort of loosely aware of ways in which is this being tackled from just a broader WASH perspective, and there's certainly some literature out there around some of the harmful ways in which things like hand hygiene has been, or broader hygiene behaviour change programs have been designed that really place that emphasis on women and reinforce some of those existing gender roles, responsibilities and norms, but also examples out there of how that's being challenged in a more transformative way, and different ways to engage women and have women really drive processes in communities and foster leadership at all levels, not only sort of at the household and community level, but more broadly in WASH programming, policies, design as a whole.
Yeah.
But yeah, Rahil, I don't know if you wanted to add, because I am aware there are other Frontiers publications that touch on this
No,
as well.
to be honest, the main point was also to bring it up a little bit into discussion. But I really appreciate as well the presentation you guys gave. It's really interesting too. I know it's not the discipline where I am as well, but it provides a lot of insights that could be reapplied in different areas too. So thank you.
Yeah, and also just to flag, there's a previous Frontiers issue on involving men and boys within sanitation and hygiene programming, and also to enhance outcomes of sanitation overall through engaging men and boys in programs. And I can put the link in the chat. But I will say that doesn't include aspects of the first 1,000 days that we speak about here for specifically for child development. But yeah.
Yeah, I would be really interested on that, and as well on the ones that Alison was mentioning too, because it would be nice to also have, you know, a bigger idea, wider idea of what are the challenges that are also being brought up for discussion. So yeah, thank you very much again.
Thank you, Diego. If there are no other questions, I'll maybe just leave it for another 5-6 seconds to check for questions. Please either raise your hand or put a question in the chat.
I think Edie was asking Rahil whether the recording of the presentation will also be made available as well as the slides.
Yes, thank you for catching that. We will have the recording of the presentation uploaded on YouTube, and it's being recorded. So we can send a link out when it's ready.
And just to say, I'm not sure if but if there are any further questions that come through, I'd be happy to follow up by email if people have any specific requests.
Yes.
There is.
Robert, do you have your hand up again, or was it from before? I'm happy to let you speak in case you have another question or comment.
So I'm sorry. It's just that two things struck me, and I'm wondering if you've got anything you can elaborate on this. I mean, how common this is. One is women eating soil when pregnant. That's new to me. And the other one is babies' poo getting into mother's food. I mean, are these either of these really serious issues? Are they widespread, or are they rather exceptional?
I can't comment so much on the second, at least in what we read for this. I didn't encounter a lot about that. On the, yeah, I think the ingesting of soil during pregnancy, I mean, Claire and I spoke about this earlier today, actually, was there are just a few papers. I think there's probably a lot more to explore, but a few papers that emerged that actually it's quite widespread. I mean, I don't know how we define widespread, but it was reported to be common across lots of cultures all over the world, and even as high in some parts of Africa, sort of 80% of women during pregnancy were ingesting soil, either because they were hungry to deal with nausea. So it is quite common. Some of the health impact, so there was, one of the papers talked a bit about some of the health impacts, is obviously dependent on how contaminated, so what's the specific source of dirt. And sometimes in some practices or cultures, it's very specific, certain mounds, that people go to certain mounds to eat the soil. Just not sort of any old soil that's around, but there are specific kind of insect mounds or etc. that people go to specifically. But yeah, I mean, we could have definitely and could delve more deeply into it, but it wasn't immediately obvious how much this had been studied in terms of potential impacts from a sanitation perspective, and impacts on what that could have on child development in utero. Specifically, but that, yeah, it was also a surprising finding for us as well during the scoping process. I don't know, Claire, if you've got anything else.
I don't really. No, I think you've summarised that well. I don't have any more insights at all, apart from the fact that I was equally surprised. I've heard anecdotally of a few instances before, but nothing to the sort of, yeah, I hesitate to say scale, because we're certainly not implying, as Alison said, that it's widespread. It's just more common across more settings than we had realised.
Yeah, thank you. And babies poo in mother's food.
Yeah, that one I didn't, find anything specific on. So,
No. Okay,
yeah.
thank you.
There is a comment by Eddie in chat saying pregnant women eating soil is common in the Gambia. It's not topsoil, it's gravel, and normally comes from well digging. So yeah, again, underlining what you said, Alison, very specific soil and during pregnancy. And I think we have one question, and maybe I'll say this is the last question before we close. But a child is usually close to the mother and the father in our context. How does differences in gender and wash needs affect child development? So I'm assuming, yeah, sorry, go on.
I mean, I can just, I guess, comment on that, just some of the some of the sort of gender considerations, I guess traditionally, because that might be common across several contexts, that often, I guess, some of the behaviour change related issue or programming or discussions are often then targeted specifically at women and sort of increased burden, or targeted exclusively at women because of that proximity and time that's spent with their child. But it's certainly more dynamic on that in practice, and I can talk to, I guess, one particular study, particularly in the early sort of phases of child development, so when a child's returned to home after childbirth, and just even looking in terms of hand hygiene and handling the baby and sort of potential infection risks at that actually, while the baby might spend the most amount of time close to the mother, the amount of contact events from different people in the household, be that the father, be that relatives, can be incredibly high during this period. This is one specific example, but just sort of highlights the dynamic nature of this, so that there are lots of touch points where people are interacting with the baby, but not washing their hands during those processes. And, you know, some of the messaging will be targeted at the mother to be responsible for encouraging people to wash their hands or adopt safe hand hygiene during those specific periods. So some of those considerations would be looking at the power in that family structure, and should it be kind of targeted at the mother and the responsibility fall on her because the baby spends the most time close to her, and does sort of the power within those family structures allow for some of those sort of behaviours and promotion of the mother to adopt safe hand hygiene around the handling of the baby, or should there be other people involved? If and how can you understand some of those gender and power dynamics that might need to be addressed, different people involved, different ways of approaching it, to one, not overburden her in particular, but also to really target those people who might be putting the baby at risk through poor hand hygiene, that are not really engaging in any of the discussion, health promotion, communication around it. So that's just kind of, I don't know if that's too specific, but it just gives one example where while the baby might be close to the mother most of the time, that actually some of those infection risks and dangers, say from a hygiene perspective or other perspectives, are more complex than that, that the role of gender and power can influence the effectiveness of certain approaches.
There's a comment in the chat from Eddie also saying the responsive parenting program that they're implementing is targeting both mother and father to encourage both parents to participate in the care of the child rather than it being the responsibility of just the mother. We are almost at time. So thank you very much for all of your participation and a very interesting discussion. Thank you, Alison and Claire, for your very interesting and clearly very thought-provoking presentation. I will be in touch with everyone with slides from this presentation, as well as a link to the recording. I think that's it. Alison, Claire, any sort of final words?
I think just to say thanks to everyone for coming, and you know, I think Alison's email address is connected to the report, so we'd always welcome any further feedback that people have or any other ideas they've got around measuring, exploring this evolving space, and equally any other case studies or examples which demonstrate, you know, further linkage in this space or positive outcomes or otherwise in exploring improvements to WASH for benefits of child health and development. So yeah, stay in touch, and we'd like to hear more examples of this in practice. Great, thank you. Anything you'd like to add, Alison?
Just the same, just to say thank you, and for all the insightful questions and discussion. Yeah, it's been great.
Yes, so thank you all. Please stay in touch and expect an email from me sometime soon. I think that's it. Thank you.
And thanks for your help with sharing.
Yeah, that's
to you as well.
Okay.
Thanks, everyone.
I'm going to close now. Bye.